Over the years in radiation, both for women being treated for breast cancer and men with prostate cancer, we're trying to find ways to improve convenience, but at the same time not lose anything in terms of effectiveness or side effects. So with breast cancer, we went from 6 weeks to now, for many eligible women, we can do it in 4 weeks. For prostate cancer, it's generally 8 to 9 weeks. In the most recent studies out of Fox Chase in Philadelphia show that we can do it over the course of 28 treatments for the right patient, depending on the Gleason score and the biopsies. So that not everyone is eligible. Then we're even looking at a treatment called CyberKnife, where it's higher doses over a shorter period of time, delivered more pinpoint directly to the prostate. So that would be extraordinarily convenient because you're doing it over, 2 weeks rather than 8 weeks or 5 treatments. Those are mostly in clinical trials because we want the long-term results to show that doing it in 5 treatments is just as good as doing it in 30 to 40 treatments. So, because of the technology continues to improve, our ability to design and deliver radiation in a safer manner, we're able to test these different strategies out to hopefully allow that to become the standard of treatment in the future, doing it in a much quicker way. And we're able to do that for like certain lung cancers, certain types of liver cancers, certain types of brain cancers, delivering it in 1 or 2 treatments as opposed to the 7 or 8 weeks that have been historic.
Okay.
Right. Much higher doses over a shorter period of time. So, the immobilization, on a day-to-day basis, making sure patients are in the right position, making sure they're lined up. A lot more quality assurances because they're such high doses. You want to make sure that it's going exactly where you want it to go. And also because you're doing higher doses, the margins of your treatment you want to narrow. You don't want to have big margins and allow normal tissue. So we want the tightest margins possible. That's just attributed to the radiation techniques that have been coming along. This type would be, 3 days a week, and then the second week same thing and done. And that helps normal cells repair themselves and replace themselves from treatment to treatment, whereas cancer cells don't have that ability. They've lost that in their mutation process. So that's how radiation differentiates between normal and cancer cells, because the cancer cells are killed off when they try to divide, whereas the normal cells are constantly repairing and replacing themselves. So with radiation, in the short term, you can have irritative symptoms to the bladder and the rectum, like going more often, diarrhea, but long term, we prevent long-term injury by that process. Yeah, most of the studies we have nowadays for the standard radiation are 15, 20 years out. So outside of clinical trial, you want at least 10 years, 5, 10 years of experience before you start offering it off of a clinical trial.